Miconazole is a medication used to treat various skin infections caused by fungi, such as athlete's foot, jock itch, ringworm, and candidiasis. It can also be used to treat pityriasis, a fungal infection that causes changes in skin color. Miconazole is an antifungal that works by stopping the growth of the fungus. It is best to use this medication at the same time every day to get the most benefit from it. The dosage and duration of treatment will depend on your medical condition and response to therapy. Follow the instructions of your doctor carefully. Remember to use it regularly in order to get the most benefit from it. When using Thera Antifungal 2% topical powder antifungals, apply it only on the skin. Make sure the area is clean and completely dry before applying the medication. Your doctor may instruct you to use it twice a day. If you're using the spray form, remember to shake the bottle well before applying. The dosage and duration of treatment will depend on the type of infection. Do not use more than prescribed, as it will not clear the condition faster but may increase side effects. Apply enough medication to cover the affected area and some of the surrounding skin, and remember to wash your hands after applying. Avoid wrapping, covering, or bandaging the area unless your doctor tells you to do so. Do not use this medication in the eyes, nose, mouth, or vagina. For best results, use this medication regularly at the same times each day. Continue using it until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may cause the infection to return. If your condition lasts or gets worse, be sure to inform your doctor. If you experience burning, stinging, swelling, irritation, redness, pimple-like bumps, tenderness, or flaking of the treated skin, let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the risk of side effects for you. Serious side effects are rare, but you should contact your doctor immediately if you experience blistering, oozing, or open sores. Seek medical help right away if you have symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so always consult your doctor or pharmacist if you notice any other effects. Before using Thera Antifungal 2% topical powder, make sure to inform your doctor or pharmacist if you have any allergies to miconazole or other azole antifungals. It's important to discuss your medical history with your healthcare provider before using this medication. If you are pregnant, it's essential to weigh the risks and benefits with your doctor before using Thera Antifungal. Additionally, it is unknown if this drug passes into breast milk, so consult your doctor before using it while breastfeeding. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. When using Thera Antifungal 2% topical powder, it is important to be aware of potential drug interactions that may affect how this medication works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Before making any changes to your medications, be sure to seek approval from your doctor. If this medicine is swallowed, it can be harmful. If someone has taken too much and has severe symptoms like passing out or having trouble breathing, it's important to call 911 or go to the emergency room. It's also important to contact Poison Control for further guidance. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. Do not share this medication with others. If your doctor has directed you to use this medication, use it for your current condition only. Do not use it later for another infection unless your doctor tells you to. When treating pityriasis, this medication may not cause an immediate return to normal skin color. It may take several months after treatment is completed for your natural skin color to return. Make sure to follow your doctor's instructions carefully. If you forget to use Thera Antifungal 2% topical powder, use it as soon as you remember. If it is close to the time for your next dose, then skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. When using Thera Antifungal 2% topical powder antifungals, it's important to follow the storage requirements listed on the package or ask your pharmacist for specific instructions. Make sure to protect it from light, and if you're using the gel or spray, also protect it from open flame and heat. Keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed. Properly discard it when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.